Pneumonia. Pneumonia is a medical condition that causes inflammation of the lungs, often as a result of a bacterial, viral, or fungal infection. This inflammation can make it difficult for the lungs to function properly, leading to symptoms such as coughing, fever, chest pain, and difficulty breathing. Pneumonia can be a serious condition, especially in young children, older adults, and people with weakened immune systems. Let's take a look at the causes. Pneumonia can be caused by a variety of microorganisms, including 1. Bacteria, such as Streptococcus pneumoniae, Haemophilus influenzae, Legionella pneumophila, and Mycoplasma pneumoniae. 2. Viruses, such as influenza virus, respiratory syncytial virus or RSV, and adenovirus. 3. Fungi, such as Pneumocystis jirovecii, which is commonly seen in people with weakened immune systems. 4. Other types of organisms, such as parasites and mycobacteria, can also cause pneumonia in certain cases. Pneumonia can be acquired in several ways, including 1. Community-acquired pneumonia or CAP, is acquired outside the hospital or other healthcare settings. It is the most common type of pneumonia and can be caused by bacteria, viruses, and other microorganisms. 2. Hospital-acquired pneumonia or HAP, is contracted during a hospital stay, usually after an invasive medical procedure. 3. Ventilator-associated pneumonia or VAP, is a type of HAP that occurs in people who are on a ventilator to help them breathe. 4. Aspiration pneumonia, occurs when food, liquids, vomit, or other substances are inhaled into the lungs, which can cause infection and inflammation. 5. Opportunistic pneumonia, occurs in people with weakened immune systems, such as those with HIV, AIDS, cancer, or organ transplants, and can be caused by unusual or uncommon microorganisms. How will you know if you or someone you know shows symptoms of pneumonia? The symptoms of pneumonia can vary depending on the severity of the infection, the underlying cause, and the individual's age and overall health. Some common symptoms of pneumonia include 1. Cough, which may produce phlegm or pus. 2. Fever, which may be high in some cases. 3. Shortness of breath or difficulty breathing, especially during physical activity. 4. Chest pain, which may be sharp or dull, and worsen when taking deep breaths or coughing. 5. Fatigue or weakness, which may be severe in some cases. 6. Sweating, chills, and shaking. 7. Loss of appetite and nausea. 8. Confusion or changes in mental status, particularly in older adults. 9. Bluish tint to the lips or nails, which can indicate a lack of oxygen in the bloodstream. It's important to note that some people, particularly young children and older adults, may experience fewer or milder symptoms of pneumonia. Moreover, some people with weakened immune systems may not show typical symptoms of pneumonia, and their condition may be more difficult to diagnose. On that account, consult a doctor if you suspect that you or someone you know may have pneumonia. The diagnosis. Pneumonia typically involves a combination of physical examination, medical history, and diagnostic tests. Health professionals will ask about the symptoms and any underlying medical conditions that may increase the risk of pneumonia. During the physical examination, the healthcare provider will listen to the lungs with a stethoscope to detect any abnormal sounds, such as crackling or wheezing. They may also check for signs of fever, rapid breathing, and other symptoms. Diagnostic tests may include 1. Chest X-ray or CT scan. Imaging tests can help detect inflammation or fluid in the lungs. 2. Blood tests. Blood tests can check for signs of infection, such as elevated white blood cell count. 3. Sputum culture. A sample of mucus coughed up from the lungs can be examined in a laboratory to identify the type of microorganism causing the pneumonia. 4. Bronchoscopy. A thin, flexible tube with a camera on the end can be passed through the nose or mouth into the lungs to examine the airways and collect samples for testing. 5. Pulse oximetry. A small device called a pulse oximeter can be attached to the finger to measure the oxygen level in the blood. The diagnostic tests will depend on the severity of the symptoms, age, and overall health of the individual. Once the diagnosis is confirmed, the healthcare provider can start appropriate medication. The treatment for pneumonia depends on the severity of the infection, the underlying cause, and the individual's overall health. Treatment typically involves 1. Antibiotics or antiviral medications. If the pneumonia is caused by bacteria or viruses, antibiotics or antiviral medications may be prescribed to help clear the infection. 2. Rest and hydration. Rest and hydration are important for allowing the body to fight the infection and recover. It's recommended to drink plenty of fluids, such as water and electrolyte solutions. 3. Oxygen therapy. In severe cases, oxygen therapy may be necessary to help maintain adequate oxygen levels in the bloodstream. 4. Hospitalization. People with severe pneumonia or those who have underlying medical conditions may require hospitalization for treatment. 5. Supportive care. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, may be recommended to help relieve fever and discomfort. Cough medicine may also be prescribed to help reduce coughing. It's important to complete the entire course of antibiotics or antiviral medications, even if the symptoms improve. Failure to complete the full course of treatment can result in the infection returning or becoming more difficult to treat. In addition, get plenty of rest, drink fluids, and follow the healthcare provider's instructions for self-care at home.